Hello and welcome to NCTV episode 32, and this one is all about arthritis and what you can do to help it. To define arthritis in a nutshell, it's a common condition that causes pain and inflammation in a joint. For those who like a stat, here in the UK more than 10 million people have arthritis or other similar conditions that affect the joints. Contrary to popular belief, arthritis actually affects people of all ages, including children. Another interesting fact is that there are over 100 different kinds of arthritis and related conditions, but the two most common forms are osteoarthritis and rheumatoid arthritis. So just to go with those two and into those two a little bit more now. Firstly, osteoarthritis. This is the most common and it affects nearly 9 million people in the UK, most often people in their mid-40s and onwards, and is more common in women or those with a family history of it, but can occur at any age and as a result of an associated injury or related conditions such as gout or rheumatoid arthritis. Just into the anatomy a little bit more now, and osteoarthritis initially affects the smooth cartilage of the joint, making movement more difficult than usual, leading to pain and stiffness. Once the cartilage lining starts to roughen and thin out, the tendons and ligaments have to work harder, and this can cause swelling and the formation of bony spurs called osteophytes. Severe loss of cartilage can then lead to bone rubbing on bone, altering its shape and forcing the bones out of their normal position. You'll most commonly see this affecting the hands, spine, knees and hips. Onto rheumatoid arthritis now, and in the UK this affects more than 400,000 people. It often starts between 40 and 50 years of age, and women are 3 times more likely than men to get it. In rheumatoid arthritis, the body's immune system targets affected joints, which leads to pain and swelling. What happens here is that the outer covering or synovium of a joint is the first place affected, and this can spread across the joint, leading to further swelling and a change in the joint shape, causing the bone and cartilage to break down. People with rheumatoid arthritis can also develop problems with other tissues and organs in their body. Just to mention some of the other types of arthritis and related conditions before moving on. Firstly, there's Ankylosing Spondylitis, which is a long-term inflammatory condition that mainly affects bones, muscles, ligaments of the spine itself, and it leads to stiffness and joint fusing. Other problems can include the swelling of tendons, eyes and large joints. Next, fibromyalgia, which causes pain in the body's muscles, ligaments and tendons. Lupus, an autoimmune condition that affects many different organs and the body's tissues. Gout, a type of arthritis caused by too much uric acid in the body. This can be left in the joints, usually the big toe, but can develop in any joint, causing intense pain, redness and swelling. Psoriatic Arthritis, an inflammatory joint condition that can affect people with psoriasis. Enteropathic Arthritis, a form of chronic inflammatory arthritis associated with inflammatory bowel. There are 2 main types, being ulcerative colitis and Crohn's disease, and about 1 in 5 people with Crohn's and ulcerative colitis develop enteropathic arthritis. The most common areas affected are the peripheral joints in your limbs and the spine. Reactive arthritis, and that's inflammation of the joints, eyes and the tubes that urine passes through, the urethra, and it develops shortly after an infection of the bowel, genital tract, or less frequently after a throat infection. Polymyalgia Rheumatica, a condition that almost always affects people over their 50s, where the immune system causes muscle pain and stiffness across the shoulders, tops of the legs, and it can also cause joint inflammation. Moving on, and whilst there's no actual cure for arthritis, there are many treatments that can help to slow it down. With osteoarthritis, that could be lifestyle changes, osteopathy, and other complementary therapies, medicines and surgery. On the whole, with mild symptoms, they can be managed with simple measures like regular exercise, losing weight if you're overweight, wearing suitable footwear, or using joint supports to reduce the strain. When it comes to exercise, less weight-bearing activities such as swimming, cycling, that type of thing are more advisable, and you want to aim for around 150 minutes of moderate aerobic activity a week, plus strength training or exercises on 2 or more days of the weeks of the major muscle groups. Posture-wise, avoid staying in one position for too long, and if you're at a desk, make sure the chair is at the correct height and take regular breaks. Treatment for rheumatoid arthritis aims to slow the condition and minimise the joint inflammation to help prevent joint damage, and treatments for this include medication, osteopathy again, physiotherapy, podiatry, acupuncture and surgery, to name a few things. As far as nutrition is concerned, for arthritis on the whole, avoid any potential problematic foods you feel may be contributing, and stick mostly to a balanced Mediterranean style diet, which is based on vegetables, fruits, legumes, nuts, beans, cereals, grains, fish, and unsaturated fats such as olive oil. Some people have found supplements such as calcium, vitamin D, fish oils, glucosamine with chondroitin also to be helpful in preventing osteoporosis, especially if you're taking steroids. So there are some of the main things you can do. Obviously there are plenty more. It's a pretty huge topic, but that's a start. And thanks for listening to this week's bite-sized bit to help your health flourish. See you next time. Bye.